yesterday evening I felt like I was coming to this conference being a bit of Bambi on the ice, because I'm not a medical doctor, I'm not a professor, I do not know anything about personal medicine. As Jenny said, I know something about EU funding, and I'm here to tell you about a project that we have that we are leading in the region of southern Denmark. It's called DISH. It stands for Digital and Innovation Skills Helix in Health. And I have agreed with Wout that I will show you this project, because the way that we have constructed this project and the way that we are dealing with skills in health, maybe we can use this construction of a project focusing on innovation and digital skills, actually within personalized medicine as well. So it's a bit to give you an idea of how can we actually make a European project within health. And maybe later on we can then make a workshop and we can try to find out if this is an area where we could actually collaborate to make a European project focusing on skills within personalized medicine. Well, I will not use a lot of time on this, because you probably know even more about this, about the burning platform in EU, the demographic changes and all the challenges that we have in the healthcare sector. But that is, of course, also the starting point for this project. So, especially within the innovation and digital skills, we have this issue. I suppose that it's the same in your countries as it is in the southern Denmark region, that patients are often turning home from hospital much earlier than before. So you need some monitoring instruments to monitor their cure and care at home. We have a much more holistic view on patients, so we need much more interdisciplinary collaboration. I've also heard that you have talked about this within personalized medicine. There is an empowerment of the patient, which of course also needs some new competences within the healthcare staff. And then we have this massive application of new technologies as well within health, which of course also needs new competences. So the idea, it's not, I don't like to stand here actually. I'll turn this around. How? Yeah, it's much better. Then I can stand here. I feel so prison-like there. So in 2016, we made a needs analysis in the region of southern Denmark, within 4 municipalities in the very southern part of the region. And this analysis actually showed that there is a lot of health technologies that we have developed, and we are trying to apply them in the region. But actually the healthcare staff needs very basic skills in order to apply all these technological solutions. And it goes both within the hospitals, but also within the municipalities. And you should know that in Denmark, the municipalities, they are taking care of everything concerning rehabilitation, care in the homes and so on. So it was a massive challenge actually in our region to make sure that all these applications they are actually used, because you know that a lot of things have been developed, but it's actually skills that are so important to make sure that the technological solutions are actually used in the healthcare sector. So the starting point for DISH was this needs analysis, of course, but then also a very important, you have all talked about that as well, this sustainable development within the healthcare sector. And the way that we work with sustainable development in this project is that we are looking both on the economical side of the healthcare sector. So how can we improve the efficiency within the healthcare sector? We're also looking at quality in care, and of course looking at the individual patient. How can the individual patient get the best out of treatment and the offers in the healthcare sector? And then of course also the staff. How can we make sure that that the staff has the best working conditions and stay as long as possible in the healthcare sector, working there? Up. So the dish in this project in a nutshell is actually this missing link that is in red here. So we have this aging population, we have empowerment of the patient, which creates a lot of pressure on the health sector. We need all the new technologies. There are a lot of new health technologies developed. They are all there on the market, but actually a lot of them is not used. They're not applied in the sector. So we need all these new skills, and it's both a question about digital skills. So how can the healthcare professionals use the digital solutions? But it's also a question of making the people working in the healthcare sector ready to see where can I actually use the new technologies, to make them able to see their working condition, their working situation, and make them how can you say, ready to see where there could be possibility for innovation in their daily work. So we are also focusing on that. And then this intersectoral skills and interdisciplinary skills, because working with new technologies and empowerment of patients, and that people are getting home from hospital earlier than before, it requires that the healthcare professionals work together in another way than they did before. They need to work together with other professionals that are having other skills than them. So this is really the essential part of this work, because we think that if we look at these three things at the same time, we will make sure that more e-health solutions are taking up within the healthcare sector. So the main deliverables in this project is that we are working, I will tell you about this in the next slides. So we are working on a concept for something that we are calling Learning Innovation Unit. We are making a concept for on-the-job training, and then we are making a concept for how to assess and acknowledge skills and competences that are obtained outside the official training system. And then we will make some recommendations, as you also do in SAPHIRE. So the Learning Innovation Unit is something that we have come up with, an idea, because we can see we are working with health care providers in the project, and we can see that some of the things that are really essential for also taking up technological solutions is that very often they are not developed in close collaboration with the people who are going to use it. So the idea is here to say, okay, how can we make, this is a concept, it's not a physical unit, it's a concept that can be set up in a health provider, within a health provider, when they have an innovation issue, they have a challenge. So we will create a concept saying, okay, when you have a challenge in your hospital, for example, you can set up this unit where you are healthcare professionals, you are trainers, and you are enterprises talking together about the concrete solutions that you need in your work. Because we have also seen that it's important also from the beginning to include training when you think about innovation. If you only think about training after you have developed the innovation and you want to start implementing it, it's too late. It should be thought in already when you start your innovation process. What kind of training do the people who are going to use this technology, what do they actually need? So the idea of this Learning Innovation Unit is that we think about these things together and simultaneously, and the people who are involved in it. And then we are also going to develop this concept for on-the-job training, which will be very much focused on simulation training. So how do you actually work concretely in the hospital with specific innovation issues. It could also be personalized medicine. How do you work with the uptake of new technologies? We have often seen within the hospitals that you have these new technologies and people do not really know how to use them. So we have seen within some research that the Hospital of Southern Denmark have done, that actually if people are going to work with these technologies, they need to know you do A, then you do B, then you do C. You need to have these very concrete description of how actually to use the healthcare technologies, or else it will not be used. So this is something that we are going to focus on in this on the job training. Really going into detail about how to work concretely with the healthcare technologies. And then the last thing is this concept for assessment and recognition of these competences that the healthcare professionals have not obtained within a school, but within the hospital. And it's also something which is very important on a European level. The European Commission are talking a lot about this recognition of unofficial skills. And this is important also for the mobility of healthcare staff, that they can actually take with them and show that they have competences within innovation readiness and healthcare technologies. So this is really, you can say, an important European aspect of this project. This is something that the European Commission really wants to see. Of course, the other things as well, but this is where we really focus on giving something to the European Commission that they want. And then I have thought, so I'm not a specialist, I've just thought a bit out of the box here. So how could we actually transfer this concept to personalized medicine? And with the little knowledge that I have within this, I was thinking, we need very, as far as I've understood, very flexible and personalized solutions in this area in order to provide quality of care for the individual. So there are focus on increased and more complex assignments within this area, as I've understood. We are going to work with artificial intelligence, big data, and e-health solutions. And I could imagine that also working with personalized medicine, you also need to work in another way, much more multidisciplinary and so on. So I really think that the concept and the way that we work within DISH could be transferred to this area as well. And what I've been reading a bit before coming here, there are some challenges also in relation to competences within the personalized medicine area. You need to work much closer together. There is a request for a multidisciplinary approach and collaboration. And also as we are working with this innovation readiness, I could suppose that within personalized medicine we could transfer that to say, how are you able as a healthcare professional to look at these flexible solutions for the individual patient? There needs to be much more interaction between the clinical work, the research taking place, technologies, patient safety, and ethics. That's also an area where you could focus on competences within the healthcare staff. And much more complex assignments in the treatment, and also the empowerment of the individual patient, where also the healthcare staff could need competences. So this was what I wanted to tell you. If you want to know more about the DISH project, you can either contact me, or you can contact Trine, who is the project manager working in the Hospital of South Jutland, who is the lead partner of the project. So.